Are there any benefits of medicinal cannabis when you compare it to traditional pain medication? Obviously, the drug is not available on the NHS at all, so that's a big no, unfortunately, for cannabis. But are there other benefits we should be looking at when you compare them with the existing pain medications like opioids or gabapentinoids or even anti-inflammatory drugs? Well, let's dive deep into this and see what could be the potential advantages. I'll divide this video roughly into about 7 categories, looking into the differences between traditional pain medication and medicinal cannabis on these categories. First, let's look at the mechanisms. Now, pain medications act via different mechanisms. Anti-inflammatories act on certain enzymes called the COX, the cyclooxygenase enzymes, by blocking them, and that's how they bring about their anti-inflammatory action. Opioids act on opioid receptors. Gabapentin-like drugs act on another kind of receptors. So they have different ways and modes of achieving their benefit. Medicinal cannabis, on the other hand, acts through one particular system called the endocannabinoid system. And there are 2 receptors predominantly called the CB1 and CB2, and these receptors together are present in every part of the body: your nervous system, your immune system, your endocrine system, and every other organ within your body. So that is why the medicinal cannabis advantage could be that it could help in many conditions as opposed to traditional medications which have certain roles to play in there. That brings on to the second category of effects. For the same reason that medicinal cannabis acts on the endocannabinoid system, which is widespread, it can have multiple effects in multiple parts of the body. However, traditional pain medication are often thought about from the context of acute versus chronic pain. In acute pain, there's a good role for most of these anti-inflammatory drugs, paracetamol, even strong opioids or weak opioids like morphine or tramadol, and finally gabapentin-like drugs could be very useful in acute conditions of nerve pain. But in chronic pain, none of these drugs are usually that effective in the long term. There's certainly more research looking at cannabinoids for the long term, but we are not yet sure on how effective they will be. But watch this space there. But it does mean that with regards to endocannabinoids, the effects make it difficult to be very precise. Coming next to side effects. Depending on the amount of THC in a medical cannabis drug, you can have increased side effects like psychoactive or hallucinogenic properties, or lightheadedness or dizziness or dry mouth. The CBD is usually well tolerated and doesn't have too many side effects there, but in that sense, advantage goes to medicinal cannabis because apart from these side effects, they're well tolerated. However, traditional pain medication, whether they're anti-inflammatories or opioids or gabapentinoids, have a wide variety of side effects, have a big problem when it comes to people who have got other conditions like heart conditions or kidney problems with certain drugs. And that means that their applicability and their widespread use will have to be done with care because the side effect profile is much worse. So advantage goes to medicinal cannabis when it comes to side effect profile. Next, we look at the long-term use. Now again here, medicinal cannabis is by and large safe when you're using it in the long term, as long as they're effective, of course. As long again you are doing it in the right patient, the side effect profile in the long term is much less with medicinal cannabis. Whereas we are discovering whether it's opioids or whether it's anti-inflammatories or many of the gabapentin-like pain drugs, long-term use has a problem. We have to be careful, and those long-term use problems can range from a variety of issues like poor wound healing to addiction to dependence to tolerance, and so we have to be careful. So advantage medicinal cannabis. Next, we go on to the legal considerations. Well, as far as the legal considerations are concerned, it's only in 2018 that medical cannabis has been changed from a Schedule 1 where no research was done to a Schedule 2 wherein it is being used for medical research. It can be used for certain medical conditions. So research is still emerging on the right condition, the right dose, and the right kind of medical cannabis. But when it comes to traditional pain medications, they are approved for use in the UK. They have been used for a long time. We have a very good understanding of the issues around legal, the tolerance, the dependence, the side effect profile. They are issued on the NHS and can be given by specialist clinicians or even your primary care provider for the right condition at the right time, and we have a good understanding of the dosages also for most conditions. So the advantage goes with traditional medications in the regard with legality. Next, we address the stigma and the perception. Now, as far as medicinal cannabis is concerned, there is still a lot of stigma, not just among the general public, but also among the commissioners and the providers of healthcare and the healthcare providers themselves, because we are still suspicious of how this drug has been viewed in popular society. Things are changing, and as the research emerges and we understand better the safety profile, we may be more perceptive and receiving of this drug. But at this time, the stigma for medicinal cannabis is much higher than for traditional pain medication, which are much better accepted. Of course, with a lot of problems around the opioids and the gabapentinoids and the risk of abuse and misuse and diversion, there is a certain amount of stigma attached to opioids as well, but certainly not as much as medicinal cannabis. So advantage with a traditional medication. And finally, when it comes to cost and accessibility, medicinal cannabis is still much more costlier than most of the traditional pain drugs, and it's not yet accessible or freely available on the NHS. So the advantage goes to traditional pain medications, which are generally of lower cost apart from a couple of drugs in the strong opioid category or the gabapentinoids. And they are also available for prescribing from primary care, from secondary care and specialist care. So advantage goes to the traditional pain medication. Overall, in this video, as you've seen, there are certainly some emerging benefits for medicinal cannabis, but at this time, I think on the balance, traditional pain medications still are probably safer, more recognizable, and better understood than medicinal cannabis. Thank you for watching this video, and I'll see you in the next one.